Welcome everybody. This is Doug McCall from the International School Health Network. I'm pleased to be welcoming everybody to this session it's one of our pre-CIES conference webinars, which as everybody may have realized that the comparative education conference that we were scheduled to speak at has gone virtual. And so this is one of the pre-conference sessions that we're holding as part of our 5 sessions that lead into a panel at that conference, at that virtual conference. So I'm pleased to be introducing, in speaking order, Deepika Sharma, who is with the UNICEF and works in the nutrition program at UNICEF. Dan Leach, who is a associate professor at Simon Fraser University, and Emily Sidener, who is with UNESCO as part of the joint UN agency, interagency working group on, intergroup mechanism on school health and nutrition. Sorry if I'm stumbling, I'm trying to do 2 things at once. So I'm going to be turning to the slides and asking Deepika to begin her remarks, and then I'm going to come in after she is finished, and Dan and I will do a review of the document analysis section, and then Emily will continue on to tell us more about the interagency group. So I'm pleased to be welcoming everybody, and we'll start over. We had a technical problem uploading the PowerPoint slides, so I'm going to be sharing my screen, which means I cannot see the meeting room. So, but hopefully we'll be able to proceed accordingly. So welcome everybody, and as you're listening to the presentations, please type in questions into the chat box on the lower left-hand corner, and when the presentations are over, I'll be happy to come back, read them out, and we can have a discussion. Also, in this particular session, since we're looking at 2 draft documents, we're encouraging people to comment on those documents by sending a comment to me after the session. The last slide has the web links and the email address to do that. So, Deepika, I'm going to shift over to share my screen, and hopefully we can proceed this way. Deepika, are you seeing the screen? Seeing the slides? Deepika, can you hear me? Unfortunately, Deepika's had trouble as well this morning. Or this. Deepika, can you hear me?
Yes. Yes. Can you hear me?
Yes. Yes.
Let's just begin the presentation. So, hi colleagues, this is Deepika Sharma, and I work with UNICEF headquarters, and as a nutrition specialist, I'm the focal point and the lead on nutrition of school-age children and adolescents. Next slide, please, Doug. Thank you. And as Doug mentioned, this presentation is being divided into 3 sections. Section 1, I'm going to provide you an overview of a fact-finding survey that we have been contemplating and have been discussing and planning with Simon Fraser University, International School Health Network, and a few other partners. And we would also like to involve you in framing the questionnaire and the content of this fact-finding survey. Section 2, Doug and Dan would be providing you. They will be providing you an overview of the content analysis and document analysis. And then section 3, as Doug mentioned, Emily is going to provide an overview of the interagency efforts and how the various UN agencies are aligning on this. Next slide, please, Doug. Yes. So as I mentioned, the fact-finding survey, which is the content of my presentation in section 1. So just to give you a brief overview, this section, this survey will be useful in gathering information around the status and improvement of school-based and school-linked policies and programs that promote educational success. So that's the entire objective of this fact-finding survey. It provides us information on educational success, health and nutrition and development of students, staff, and communities or families. It will, when I talk about school-based and school-linked interventions, I think I need not preach to the converts, but just to kind of recap, it covers interventions that are implemented in neighborhoods or communities which are surrounding the school, as well as online interventions which relate to families, healthcare, youth centers, youth-friendly centers, and which are coordinated through the schools. So the guiding principle for this fact-finding survey is to inform the SDGs. As we all know that SDGs is our blueprint to achieve a better and more, I would say, sustainable future for children and for all. And we all are aware about the how interconnected the various goals are. And although I work primarily on Goal 2, but today I'm going to talk about how through our work we would be informing Goal 4 and the target 4.7 precisely, which talks about learning. And through this survey, we are trying to make a case to invest on the learner. It will bring a spotlight on learners, and as we all know that 4.7.1 and 0.2 have certain benchmarks, and it is important also to monitor the progress in achieving the school health and nutrition related aspects of target 4.7. And that is what we will be doing through this fact-finding survey. We would like to understand, as I mentioned, the current approaches on school-based and school-linked intervention. Yeah, and how these approaches are embedded in the current scheme of things or interventions across the various countries. Next slide, please, Doug. So this is, as of now, there are the entire monitoring landscape has a lot of, I would say, initiatives that have been ongoing since long. We are aware that school health and nutrition and life skill education, although it's not included in SDG 4 monitoring, and there is lack of reliable country level data. Because at UNICEF, when we started, we are initiating our work in school-age children and adolescents, and that's what we realized, that there is an absolute, there is a huge lack of data, not an absolute, but relatively less data is available on the status of school-based and school-linked intervention. There was a study that was a mapping that was conducted by UNICEF, I think in 2007, which had information on the health, which had information on the life, skill and health curriculum, but no recent data is available as of now. There are various tools which have been adopted and adapted by various organizations, and countries are implementing it, but that's not universal. There's tools, as you may be aware about, the SAVER, the Systems Approach for Better Education Results, which focuses on assessing the policy programs, but not every country is using that. Similarly, the Global School Student Health Survey, or the school-based survey, which is for 13 to 17-year-olds, is also there. Then health behavior surveys are there for children who are in schools in the age category of 11, 13, and 15. They're all self-administered questionnaire and conducted during regular class sessions. They focus on dietary behaviors, mental health, physical activity, and certain other productive factors. But although the global school-based health surveys have been conducted in 104 countries, however, the surveys are administered only when the countries have some funding support or external support available. So it's not integrated into the country level systems. Then there is also some momentum around monitoring the WASH SDGs under Goal 7. There are plans to monitor other conditions in schools as well. The global WHO had conducted the Global Nutrition Policy Review, which came out just last year, and so there have been 2 reviews as of now. However, we see that on the school-based and school health intervention landscape, we really need some recent information. We need to understand what is the current state of action and integration into other systems. Next, please, Doug. Thank you. So this is just a recap of all the approaches that we know about. We know that there is a fresh framework which is based on around 4 pillars of policies, services, education, and environment. And then there are these thematic indicators which have been defined and to monitor progress around these various four pillars. These 15 thematic indicators are various domains based on various topics, such as it could be nutrition education, it is deworming, it is malaria prophylaxis, and various other services and interventions. Then we have multi-component approaches which have been there since long, which includes the approaches and the components that are supported by various UN agencies, such as Health Promoting School, the Child-Friendly Schools, Nutrition-Friendly School Initiative, the Safe Schools, Community Schools, the WASH Schools, or the Essential Nutrition Package that was developed by WFP and UNICEF. So these are all approaches are there, although the fresh forms the basis of, it's the foundation for the delivery infrastructure for all the multi-component approaches, but still we need to understand that how these approaches are being implemented and what is the status. So the goal, overall, the goal of the survey is then to support the countries to assess and improve the ongoing efforts to promote health, nutrition, and development. And this fact-finding survey will revolve around the axis of the fresh components, that is the policy. The inquiry would be around policies, education, nutrition and health education, or school-based food and nutrition education, environment, and services. We would like to assess equity, concepts related to equity, and how the programs are implemented in schools. Next, please, Doug. Next slide, please.
Can you see it?
Yes, I can. Yeah. Thank you so much. This fact-finding survey, so now why we are doing it? Because I'm sharing with you that UNICEF started this work and restarted this work on with the intent and focus and funding in around 81 countries. And we are working in the nutrition program is there in 121 countries, and there is a huge need in all those countries. These countries are high-income countries, low and middle-income countries around the 7 UNICEF regions, and there has been a huge demand from the countries and the governments to have have something on the current status. So what we intend to do is we'll frame this questionnaire, and this will be sent to various countries and provinces, so national and subnational level. There would be questions. There are 6 domains under this questionnaire, which I'm going to explain in subsequent slides. We're going to ask questions around core components, as I mentioned, on policy, education, services, social and physical environment. We are going to inquire around what are the national priorities on school-based and school-linked services, what are the resources, is it addressing the whole child concept, and are the other ministries or the other systems contributing, like the health, the social protection, the food and WASH system, are they contributing, or are these outcomes are integrated into their regular policies also. So we're trying to do a very holistic assessment of school-based and school-linked programs and interventions in various countries. We're also going to ask the countries whether they have participated in recent global data collection exercises, and when was the last time they collected data, and various other things. Next slide, please, Doug. Next slide, please.
Can you see it, domain one?
Yes, thank you very much. Yes, so as I mentioned that there are 6 domains under which we are going to gather information at the country and the subnational level. So the domain 1 focuses on what are the core components or the content of the school-based school-linked approaches. It talks about policies, what are the standards for health and life skill education, what are the minimum requirements for when we talk about food, availability of food and other services in schools, what are the minimum requirements and standards for physical environment in and around schools, and similarly psychosocial support. So under this section, the questions will be asked to understand whether the country has a written school-based or school-linked policy on promoting health, nutrition, and development. We will also try to unpack the various aspects that are covered under the policy, like, for example, whether it is around personal development, prevention of disease, healthy diets, food environments, safe environments, whether it is overcoming barriers on to learning, and the inquiry will also include what are the standards, as I mentioned. For instance, when I talked about standards, does the country has a defined set of minimum health and safety conditions for the physical environments in or near schools? What about clean water, bathrooms or toilets, and road safety? Is there a guideline for health and nutrition services provided? What is the package that is provided in the schools, and is there a set standard? This is what would be the content of domain 1, and we'll also try and understand which ministries are supporting which components, and whether for the school-based schooling interventions, whether the countries, whether the national or the subnational level has kind of involved the UN agencies, and is there a coordination mechanism to develop effectiveness around school-based school-linked programs and policies. Next slide, please. So domain 2, here we would like to explore whether the country has conducted a thorough situation analysis, because that's on the foundation of any work that is being done around this area. Whether there is a situation analysis available, and whether the country has solid understanding of the issues and the barriers, whether they are using data, qualitative or quantitative data, to assess the situation. And we would also like to understand that how the country is prioritizing the various interventions. What is the criteria for prioritization? Is it funding? Is it political agenda? Or is it based on the prevalence and some scientific facts? And whether the partners have been involved in this thorough situation analysis. Next slide, please, Doug. Thank you.
Are you seeing the slide? I think, Deepika, I think we've got a bit of a time lag, a data lag in your connection.
Oh, okay.
I'm showing domain 3 now.
I'm sorry, I can't help it because
no, it's the internet. We can't do anything about it.
Yeah. So domain 3 is about, here the questions are framed around implementation, whether the country follows an evidence-based framework, which of the evidence-based framework it is following, the multi-component approach, which of the multi-component approaches the country is following, how the funding is being is being allocated, and is there a when the funding is allocated for school-based, linked services, is it based on some realistic cost estimates? So what is the mechanism for estimating that cost? How the human resources being costed? Curriculum time, how much time is required to train the staff and deliver the services? So whether there are these realistic, whether it's a very thought-through process and whether it's realistic, and how the fund flow, how's the fund flow mechanism? Is it timely when the fund reaches from the treasury to the subnational level? What's the time lag? Because this is a huge barrier in implementation. Next slide, please, Doug. So domain 4 is on strengthening the system and the organizational capacity. Here, we would like to understand whether there is coordination at the policy level, in human resource and monitoring evaluation. So we would like to understand whether the relevant ministries, for instance, Ministry of Health or Ministry of Education and other ministries they issued joint or statements supporting the school health, school-based and school-linked programs on health, nutrition, and development. Are there designated focal points? Is there a contact person? Whether there is a proper job description? And is there an inter-ministry committee which Is there inter-ministry committee which is managing this coordination? Is there a knowledge hub? Is there a university or agency supporting the knowledge and learning framework of the government? And is there a repository of resources? And whether the country has, as in the course of implementation, whether the country has identified any enabling factors, what is the monitoring mechanism? For instance, when the country was developing the plan or the implementation, did the country consider disruption in services as is happening now? So how realistic it is? What is the forecast? How are we identifying the various external barriers or risks and assumptions? So here in this domain, we would also like to have some we would like also to have some information on how the ministries, the key ministry, is assessing the learning outputs on health, nutrition, life skills, instruction. So all in all, this would be a very comprehensive. It's a very comprehensive domain, and that we are trying to understand. Next slide, please, Doug. Sorry. Domain 5 is on integration and mainstreaming within the core mandates of the education system. So here we would like to understand how school health, nutrition, and development is linked to the education outcomes, is improving the learning. Is there an accountability mechanism that has been developed within the university or within the ministry, and what is that level of accountability? Whether the participating ministries, as I mentioned, whether health and other ministries have specified who would be the frontline staff and how they will commit to the contribution of their frontline staff to school-based and school-linked programs and interventions around health, nutrition, and development. Next slide, please. So domain 6 is on around sustainability and the systems approach. Here we would like to understand the synergies between other ministry. Is there a common understanding on the outcomes between the various ministries on why they need to combine? What is the rationale for synergizing their efforts, coordinating, and how do they coordinate the various policies? There could be one policy in Ministry of Health. There could be another one in social protection, but how are these contributing to the health, nutrition, and development of school-age children? So this is what we want to understand. And as I had already mentioned, then there are these overlapping questions on budget line, because this is the bottom line. If a ministry contributes, then it has to be mentioned somewhere in the budget and the planning of that ministry. So all in all, these are the 6 domains around which we want to gather information. This, as Doug mentioned initially, that this entire inquiry or fact-finding survey would be available for further inputs, and it's just an initial start, but we really want to make it more robust, because that's what is the demand in the countries, and with the expertise of this group, we would really like to make this tool more effective and more informed. We'll be sharing the tool for your feedback, for your inputs, and then we have a timeline to roll it out in the next. As I mentioned, we have a timeline to roll it out in the next 2 months. So now with this, I would like to pass on the baton to Doug, who's going to focus on the content analysis, which is a subset of the documents that an analysis of the documents that you will be receiving through this fact-finding survey. So Doug, over to you, and we'll be available for questions even after this session is over. Thank you. Thanks a lot, Doug.
Thank you, Deepika. And I'm just going to, as we move to the second part, which is a content analysis of policy and guidance and curriculum documents in the countries and states, we're going to be looking at a variety of the same domains that Deepika has just gone through. We're going to organize the analysis under the documents. And we currently have 3 sort of areas that we're hoping to be able to engage in the process once we've collected the documents. We're really pleased that UNESCO has agreed to put all of the documents that we collect, both in an online searching going into each country, as well as through asking the respondents in the fact-finding survey to send us web links or copies of the documents. So it's quite a significant task of collecting the many different documents, but we'll be able to eventually have a real good collection to be able to analyze. And the 3 perspectives we're going to look at are, first of all, obviously with a health and life skills education perspective, or what we're calling health and personal and social development education. And Dan Leitch, who's on the line, is chairing a World Education Research Association research network that has over 70 people involved in it, and we're going to be trying to form teams around different themes, and health and life skills education is one of them. A second theme, and it relates to a project that Dan and I have been working on with a little bit of funding from the Public Safety Canada, which is to look at social inclusion, the sort of social education and social supports that are available in schools to include students successfully, and thereby prevent their isolation, antisocial behaviors, and violent extremism, which is the funding that we received. And the third area would obviously be in nutrition education, nutrition and promotion of nutrition, food and nutrition in schools. And so those are 3 analyses that we'll begin with subsequent to the data collection and be able to hopefully have a real resource for researchers to dig into. And that's the part of the follow-up as a process. I wanted just to show this slide, which is a little bit of a word about what we are meaning about monitoring, or what we think is important about monitoring and reporting and evaluation. In our view, it needs to lead to improvements. And this is a quote from one of the Global Education Monitoring Report that really caught my eye. And I think it discourages people if we're going to be monitoring things to be able to find out what they're doing wrong. That's not the approach that we suggest. We think that the best way to collect data, or the best intent to collect data, is to be able to enable people at different levels and different systems to identify improvements that they can make and be able to move it forward in what they see as to be relevant and urgent to their work. Hold them accountable to the choices of what they're trying to improve on, but give them the professional responsibility and professional autonomy to be able to select things that they think are more important in the work that they're trying to do. The fact-finding survey, the document collection, is connected, as I said before, to the research network that Dan chairs, but we're also involving the global network of deans of education, and they'll be looking more deeply into the capacity of education faculties that will be able to look at teacher education and development programs that relate to equity, educational success, and health and development. And so we're going to have quite a bit of follow-up from the fact-finding and leading to important changes, we hope. And as Topeka said in the beginning, this original idea of doing this fact-finding exercise was because we ran into a serious problem when we were trying to ask the various UN agencies monitoring Goal 4, Target 4.7. We're looking at what they were trying to monitor in terms of essential learnings, and we didn't have the data to be able to point out what is happening in terms of health and life skills education. And so we hope that by showing that the data is now available and being able to work with UN agencies through the monitoring process, we'll be able to get health and wellness, or health and life skills, or health and personal and social development education monitored and with a focus for improvement moving forward. And so that's really where this process began. As we said, I just said we need to lead towards improvement. There is an important set of definitions in the documents that we're going to be putting forward, that what we mean about monitoring, what we mean about reporting, what we mean about evaluation, and what we mean about improvement. And so that's important to also, we're thinking beyond just the report, but we're thinking of where does it go and what can it mean in terms of changes. A little bit of there's a challenge in school health promotion and development worldwide, and it affects all of our daily work, is that we all have to focus on a program that's responding to an issue. That reality of getting work assigned to us and getting funding or getting research dollars means that we have to narrow our focus to a specific kind of thing. But we need to think about that as in the context of the whole child. The Fresh Partners, about a year and a half, almost 2 years ago now, adopted a statement about the whole child education and a broad set of learning opportunities. And so when we talk about the whole child, we need to think about these dimensions of child development. And the first two, of course, are going to be the real primary concerns of educators. They're going to be providing educational access, and they're trying to deal with that in an equitable way. And they're trying to provide an education system that has pathways through it to be able for students to be able to achieve results and be accredited and move forward into other levels of education or into work. But there's a whole bunch of other aspects of child development, beginning with some of the basics, and food and other necessities is absolutely essential if students are going to be able to learn, and educators are obviously concerned about that, but that's when they start to build other partnerships with other sectors. And if you go through that list visually, you can see that there's safety and security and health and sanitation and vaccinations. I guess the vaccinations and immunizations from infectious diseases are obviously very relevant these days, but there's a number of aspects of child development and safety that need to be considered. And so that's the kind of question that we're including in the fact-finding survey to be able to give that sort of broader context. there are, I'm not going to walk through this slide, but really Deepika mentioned that there's many different multi-component approaches, as we call them: school health and nutrition, child-friendly schools, health-promoting schools, and so on. And we positioned the FRESH framework as identifying, excuse me, the core components that are common to all of them. But you can see the many different multi-component approaches that are likely to exist in countries simultaneously. Not all of them, but 2 or 3 of them at a time. And so those are the long list of frameworks out there that people are going to be conscious of as they're moving forward. And I remember an experience when I went into to help plan a particular country, and we were working obviously on health promoting schools, and we were with the Ministry of Health, and we were giving them the FRESH framework and helping them work through it. And then we realized that the Education Ministry was working on a different framework, child-friendly schools, and that there wasn't really a connection between the two approaches. And so we're thinking that's a very important piece that we need to have to ask about and to enable and encourage countries to be able to make those connections and alignments. When you go into specific kinds of what we call multi-intervention programs, you can see there are many, many more. And each of these programs will have multiple interventions, and again, they will be building momentum within the various systems, and so they need to be aligned and if not coordinated. And then a third level, I'm not going to go through this, but these are many different what we call learning behavioral models and underlying theories. And these are many of the different terms that are often used, especially in education, but elsewhere, that are being used as guiding ideas. And so we need to be able to understand if and when they are a guiding force within the various countries and states and provinces. And so again, we're going to be looking in the document analysis for whether or not these show up in the documents. This is the kind of this is a bit of an overview of the collection and analysis process. We're going to be, obviously this consultation is underway right now. We're looking at, when we take a look, for example, at health and life skills education or health, personal and social development education, these are the kinds of questions that we'll be asking. Required instructional time is obviously a popular one, but also how it's being delivered. Is it a health standalone program? Is it health and life skills? Is it a broader program of health and personal and social development? Is it being combined with health and physical education? Because each of those choices will have implications for the amount of instructional time. And so we're looking at trying to fit this into a picture that would be generally known by educators, but not necessarily learned by health and development folks. And so we're trying to look at that. And of course, there is a move in the education sector towards cross-curricular competency frameworks. OECD is doing a lot of work in this, and many countries are adopting them. And so as we work on health and life skills education, we need to be able to show how it fits within those very broad essential skills and knowledge that are being defined by the countries. And one gap that we immediately identified in one of our webinars in the FRESH working group was that there didn't seem to be a real use of a generic set of essential student learning outcomes in health and life skills. And so that will be an important piece. And another example would be around student agency, or what we might call student empowerment or student engagement, what emphasis is given in the documents and that kind of thing. So those are some of the examples of the kinds of questions we'll be looking at in terms of document analysis. Our methodology is going to be actually quite similar to a recent OECD analysis of physical education curriculum that was done in 16 high-resource countries. Brookings Institution did a preliminary analysis looking at 21st century learning skills, which are close to but not quite the same as life skills. And there was also a study done by the International Bureau of Education, UNESCO, that used the curriculum analysis and looked at global citizenship education, and their primary data source was social studies curricula. So our methodology is similar to those studies, and hopefully we'll be able to fit in with the idea that we're eventually going to feed into the UN SDG monitoring process. The best way to look at the kinds of documents we're looking at is to look at an example of one jurisdiction. This is in one of the provinces of Canada. And if you look across the top of the table there, you're going to see the contextual data, the description of the country or the state. Again, this was methodology used in other studies, so we'll try to piggyback on those to find them. We won't be asking about them. We'll find them about the nature and structure of the education system and so on. So there's materials out there that we'll be able to collect on that. Policy and other documents, we'll be looking at whether or not they have policies such as these that do exist in Manitoba. There's an education for sustainable development policy. There's an anti-racism policy. They have a policy on safe and caring schools, and they have, for example, healthy schools plans. And each of those multi-component approaches will have an educational component. So we're going to be looking to see if those have those documents, and then we'll analysis done within the documents as we later into the process. Cross-curricular documents, there's obviously every jurisdiction will have a graduation requirement or a national curriculum framework, and we'll be looking into that. There are in Manitoba, and there will be similar in various jurisdictions, the different elements integrated into curriculum. That's sort of an interdisciplinary approach. They've also defined 4 foundational skills across all curricula, and they also have a very important look at career education and development. So the documents that are in the education sector that will have implication on health and life skills education. If we go to the other subject areas, which are traditionally quite traditional, health and life skills, social studies, language arts, and so on, we'll be looking for those kinds of documents. When we define health and personal social development education, we're primarily interested in what's happening in the HPSD curriculum, but we know that there's crossovers in terms of social studies, in terms of language arts, in terms of moral and religious education, and so on. And so those we'll be able to see the connections around health and social development across the curriculum. And you can see the documents that were appeared in Manitoba. This is a very quick look, but you can see that we're looking for what their subject curricula do say in terms of outcomes, whether there's going to be instructional time that's defined or recommended or required, and so on. And then, of course, in terms of social studies, which is more important in the area of social inclusion, we'll look at the global issues that are being studied, or the foundation of a contemporary world, it's global education, and so on. We'll be able to being able to gather the documents across that grid. In terms of the other subjects, an area that's not yet been really talked about in terms of social development and global citizenship is whether or not systems do offer the majority language instruction to immigrant and refugee students. That's an important part of inclusion. Whether they offer languages in ancestral languages that are not in the majority language. In the Manitoba case, they have a real strong Aboriginal education program, and so on. And then one section that's not on this chart, but it is in the material that we've developed, is a closer look at teacher education and development. So we're gathering a whole slew of documents for every jurisdiction, both from web searching and through the fact-finding survey. And this is a quick look at why the two investigations can go together. The fact-finding survey can ask about those kinds of things in question 1, and then the document analysis can do that kind of in-depth analysis, which looks into the kinds of things that relate to, gives you a broader picture and more of an in-depth picture. So before moving on to the section, maybe for Emily, Dan's involved, first of all, because of his policy expertise, and policy and leadership is his focus within the Faculty of Education, but also he chairs the International Research Group. Dan, do you want to share any observations at this point about how we can, what steps we need to think about as we move forward? We're going to obviously do a lot of scientific work under your direction to be able to make sure the questions are actually good questions and will give us accurate data. But any observations on the overall process at this point that you can offer?
Sure. A couple of comments, though, before we go too much further. There's some really good questions that are being asked in the chat boxes. I don't know if you have been monitoring that, but I want to make sure that we will have the time to respond to those. A lot of questions about the survey and action that might stem from the survey. Specific, I think, to what you were talking about, and it does address one of the questions that is in the chat box, is that the survey is still under development, and so we do have to test it and put it together and validate the items of the survey. So it's very much a effort that is still in process. And I think the key thing that you highlighted is the work that the World Education Research Association is doing, and our research network is doing, and the opportunity for people who are on this call and in the broader community to partner in that. And so, if there are people that are listening, or if you know people that are active in research in this area, it would be an opportunity for us to collaborate and make sure that we bring a broader set of eyes to the activity. But have you gotten a chance to take a look at those questions, and do we have a space for and time for addressing those questions set up for the presentation?
Yes, we do. We're going to get. We're running short on time, but yes, we'll extend this session to answer them for sure, and then I'll make sure that we follow up with posting them on the web pages that relate. But sorry, Dan, I can't see the questions coming up on the screen because I'm just looking at the slides. That's all I can see. So yes, we will come back to them. So perhaps what we can do is ask Emily to make her remarks, and then we'll come back and try to get through as many of those questions as we can. And thank you for pointing out that this is really a draft that we're very much still working on. Emily?
Thank you, Doug. And being conscious of the time and to allow some space for the discussion, I'll try to be brief. And I'd like, first of all, to thank you for this opportunity to present and discuss with you this renewed UN partnership to advance school health and nutrition. It's really great to have the opportunity to share with colleagues and partners here. So the first thing I'd like to share is that this partnership was initiated in an interagency meeting hosted by UNESCO last year. And the idea was to chart a new joint approach for school health and nutrition to support, as a starting point, to support better education outcomes. And in that meeting, unanimously, the 7 agencies that participated agreed that much more needed to be done in the area of school health and nutrition, recognizing that the area is still neglected in national funding and priorities and in global strategies, and that more alignment, coordination, and joint work was required to achieve meaningful results. In a way, there's a very strong consensus and evidence on the importance of school-age children's health and nutrition. There's strong evidence also on the critical role of schools and school-based programs to address the needs. And we also know what works. We have knowledge on the interventions that are required. There's very broad consensus that the FRESH partnership actually has helped building on the need for integrated multi-component approaches. Yet there's not enough progress that has been done in this area. And so in this meeting, the agencies committed to work together and to renew their partnership, to step up their efforts, also to support countries to scale up institutionalized, adequately financed school health and nutrition programs. And that we really with the view that all the children that need them should have access to quality, integrated and effective programs on the ground to respond to some of the comments about the implementation. We know that the implementation at scale in a sustainable way is the main challenge. So the main purpose of this partnership is through united action to mobilize governments and partners to better align investments and bring proven interventions to scale, and also and importantly to respond to learners' needs in a holistic manner. And for that, the agency is committed to work together through a renewed partnership. while the initial focus has been on bringing UN agencies together, it's important, I think, to note that the ambitions moving forward is to mobilize a coalition of partners that would include governments, development partners, NGOs, civil society organizations, and of interest for this group, research institutions working in this area. And as you can see here, we are already coordinating through the FRESH network, which has been really a very great experience. Some of you might ask, why do we need another initiative or a renewed approach? There's many initiatives already going on, and the PICA listed some of them, and you are aware of that. Our feeling was that while there's already very strong frameworks, and FRESH has been doing an incredible work in providing an informal technical platform to share information and practice, the joint work is still insufficiently coordinated, and more synergies are required, more alignment are required, and agencies need to speak in one voice to really mobilize efforts and ensure better integration and coordination at the country level, and ensure their support and engagement with the countries are efficient and bring results to scale. So this is really at the core of the rationale for having this initiative and for renewing the partnership with an initial focus on UN agencies and multilateral partners. I don't want to take too much of the time, but I'd like to just say, if we can skip this slide and move to the next one directly, Doug.
Is that the right one?
That we have identified 4 core areas of work. The first one is joint advocacy and speaking one voice to put school. Next one, please. Where there is the graph. Well, we can stay here. There's a first area of work is joint advocacy and ensuring we speak in a coherent way to elevate school health and nutrition on global, regional, and national agendas, and mobilizing funding and support. The second one is around generating and disseminating better data, and the survey and the exercise we've been discussing is certainly something that contributes to that, and there's strong linkages here to be made. And the ambitions of the partnership is to be able to publish a first status report on school health and nutrition next year that would provide a landscape of the efforts so far. I'll come back to that later on. And then the 2 areas of work are around joint evidence-based guidance and standards that are linked and responsive to country needs. There's a lot of guidance out there, but actually the countries don't necessarily have the tools to implement integrated approaches and policies at the country level, and the guidance is not always aligned, as we've been discussing. And however, there's a lot we can build on already, so that will be an area of focus for us. And then practically at the country level, looking into how we can do better coordinating policy advice and where needed, implementing coordinated programs at the country level, linking with the national education systems and national health systems. So having a systemic approach also at the country level for sustainability. May I suggest we go straight to the next slide, and I'll just mention the status report on school health and nutrition we would like to undertake. The ambition is to have a first consolidated reference document that provides an overview on the status of school health and nutrition core components worldwide, building on the FRESH framework as a starting point. I think the PICA really showed there's no global overview right now on current national policies and strategies regarding school health and nutrition. And what we like to do first is to have this overview on the policies and strategies and what the countries are focusing on. Secondly, to see whether countries are implementing them and at what scale, and identifying possible challenges in scaling up interventions in a sustainable way. And that could then be used as a baseline to track progress over time through future iterations. And as one of the core goals of this partnership is also advocacy and positioning school health and nutrition in national priorities. We hope this publication could be used as a tool for advocacy purposes and to position the issues in the agendas at different levels. I'll stop here because I'd like to make sure we have time for questions and discussion. And thank you again, Doug. I'd like to say this is we are at the very, very beginning of the thinking of what this publication could look like and be conducted. So this is a great opportunity to receive initial thoughts from the group and see how we can connect with the initiatives going on already.
Great, thank you very much, Emily. And if people can keep the web address that's on the screen now, the freshpartners.org website, if you go to that website and look for the webinars page, you'll see the links to these three key documents: the FRESH framework, of course, the core components, and then the 2 draft documents. And if you would be able to send comments on those documents during or after this session, I'd be very pleased to receive them. I'm now going to go to the questions and we'll do as many as we can in the time available. These questions are all, I'm just scanning up now because I've not been able to follow them as they've been posted, and thank you for doing that. We'll be able to, we'll have a record of all these questions and be able to respond to them either in revising the documents as we've got them or further. I'm just looking for the first sort of content-related questions, which begin with right after Kadis Natu. Oh no, you're just an introduction. Sorry, let me just go to. And I apologize for the technical problem here. We somehow couldn't upload the PowerPoint presentation into this, so I could do a better job of facilitating. And Raul, yes, if you type questions, if you have not already done so, or if you just send me the questions and comments, we'll be able to be pleased to follow them up. And as Dan said, there will be lots of time. And as Raul has been asking, yes, the survey will be validated and tested and before proceeding. Question around Raul is asking, I work in India, they have government policies, key challenge is implementation, and hopefully the presentations and how does the survey get at the implementation? And maybe that's a good question to try to answer a bit and to refer to some of the slides that Deepika was talking about. The FRESH framework has really broadened its focus from just the core components and the topic or thematic indicators to try to look at core indicators around implementation and implementing, maintaining, and sustaining and capacity building kinds of questions. And so they are included both in the fact-finding survey and in the document analysis. And there is a pretty solid set of questions that the FRESH framework has been working on. In another one of the webinars in this series, there's a session on cross-cutting themes, and so we are trying to get at those issues. And so if we can ask some good hard questions, both in the fact-finding survey as well as in the document analysis, we'll be able to start to move in that direction. Edwards asked a question regarding the survey as an opportunity for coordination with other agencies. Yes, absolutely. If your agency or you individually would like to participate or be involved, please just send me an email and we'll be sure to follow up on that. We've already done that in a very initial invitation. We've got some responses, and for those of you online who have already responded, we won't forget you. We've got you on our lists, and we will be reaching out to you once we've got a working draft, a couple of working drafts to working with. So yes, there is lots of opportunities for further involvement. And yes, and yeah, and Nadu has asked about the implementation issues. Yes, we are trying to address them, and there's many questions around implementation, capacity building, and also the themes around working within the school systems. Mainstreaming is another big barrier, and another category. One of the domains is also looking at how we move towards a systems approach. Raul's asked about what we're going to be doing with the survey and what is the action, and what we're trying to do, as we've indicated, is we've tried to build a couple of different steps into this, and we're very pleased that UNICEF and Topeka is already building the results of this into their program planning around schools and nutrition, and we're very pleased that Emily and the other partners in the interagency group are looking to receive this data and to build on it for their more substantive and ongoing look, we hope. We are going to be taking the results to the policy level in terms of the SDG monitoring process, so we'll be able to show that monitoring health and life skills education, or health, personal and social development education, is indeed possible. We're also trying to ask the questions in a way that would parallel the questions that are being asked in that process within the SDGs around topics such as global citizenship education, human rights, and a variety of other topics. We're going to try to parallel so that we can provide data that is compatible with the SDG process. So those are some of the examples, and we'd be pleased to receive any other suggestions moving forward. One area that is going to be the real challenge, and it's not a challenge that's solved by a survey or a document analysis, is the reality of countries being able to put all these pieces together in a way that makes sense for them. And so very pleased to see that the Joint Interagency Group is looking at the country level coordination, because the more that we can do to align our efforts from the global level, the more likely or the more possible it is for that kind of interagency, interministry coordination to happen at the country level. And the challenge is that those challenges don't go away, but hopefully we'll have some basic facts to work with. Christophe has asked about timelines, and just to respond, I'm sorry to keep going because I am conscious of time, but we are looking at a different timeline than we thought for this project a few months ago. COVID-19 has really taken many people in the field and at the global level away from their normal jobs, and so we're trying to readjust around the timeline. But we are trying to get into the field, the fact-finding survey and the document analysis which accompanies in the month of June. We're trying to assess whether that is first of all a time when education ministry officials will have the time to look at this. If they've been reassigned to COVID-19 responses, and in the education sector, there's been a whole shift, as you know, of trying to move things online or to find different ways of reaching the students, and so a lot of the staff assignments have changed. But that's our hope, is that we're going to be able to circulate the questionnaire to national respondents in June, and then work subsequent in terms of reporting. But hopefully that will be better answered as hopefully as the COVID-19 crisis is managed. So that's we're looking for now. Leo's asked a question about other surveys done in Latin America and the Caribbean. We would be pleased to follow up with that to make sure that the questions, as the maximum degree possible, are aligned. By asking the question, Leo, you've pointed to some of the regional questions we've asked. We can look at. We've been trying to align the questions in the survey and in the analysis to existing questions or criteria in the documents, in the several self-assessment tools that are published by global organizations. The World Bank has a good set of questions around their school health and school feeding programs. The Fresh Framework is a useful starting point, as well as the Thematic Indicators. We have the Global School Health Policy and Program Survey that was developed by WHO. Was field tested, but I'm not sure it's ever been used extensively in the field. We're not really asking about behavioral questions, but we are trying to learn from the health behaviors of school-aged children and the Global Student Health Survey about how they've followed up the data collection with analysis. It's probably a better example is the HBSC survey, which is done in Western Europe and in North America, where there's a whole cadre of researchers who are working on regular administrations of those surveys. That's what we're hoping to work towards by having a research network developed at the same time as the data survey. So please, if you have regional surveys that we can look at, our focus has been on the global instruments that are available from UN agencies primarily, but others are available. One I was looking at most recently is there's a survey done by the International Association for Evaluation, I think it's called IAE, which is being used as a reference point for the SDG monitoring, and they have a question, what they call a national context survey, which I'm tracking down, and hopefully that will be something we can align with very carefully. Melissa's asked about a survey, done a survey in FAO about food at school food and nutrition education. It was evident that the need for multi-level and complementary survey components. Our level is only at the national or state provincial level, but we'll try to align those as much as possible. Melissa, if you could share that survey with me, we'll try to make sure that, again, there's as much alignment as possible. Okay, and Morales made a good comment about his time for surveys is frustrating. We, as we're doing our best, we're trying to connect it to what we know our policy and other investigative processes, but it is a challenge always. Michelle has asked about taking the COVID crisis into account, and yeah, I think I referred to that as well, and so we're trying to figure out how it's really pushed people around in their jobs, let alone the families and students and people affected by it more directly. So how the education system is going to respond in the longer term? Good question, Michelle. That we'll have to put on our agenda for thinking about. Deepika has thanked people. Raul's repeating about action. I'm looking from Suzanne. In a number of countries, life skills and health education are also taught through home economics. We have not contacted the International Federation of Home Economics, but that would be very useful to engage them, and I will undertake to do that. We have considered home economics as part of the curriculum structure that we're asking about, and we'll be looking at that more carefully in the document analysis. Many countries do have home economics as a core subject or an elective subject later on in high school, and so that will be part of the document mapping that we'll be able to do. It may very well be that we can engage the International Federation or federations like them in following up. I do want to take the chance, though, to say that we're not really looking at physical education, except by noting where it's connected to in a joint health education and physical education program. We're looking more at the health education side. The reason we chose to do that is that OECD has done a good job of analyzing physical education, and that analysis could be extended to other countries, and we would suggest that might be a route for a more in-depth look at physical education curricula around the world. The OECD study was 16 countries, high-resource countries, but we're not going to be looking into we're actually not going to be looking into deeply into the content of either phys ed or home ec in depth, but we will be trying to look at how they correlate to what we've defined as health and personal and social development education. So I hope that's so. If I hope I've covered most of those questions quickly in the with my scan. But if people want to add comments, please click on your mic and just say hello, introduce yourself, and raise a question or a comment. Be pleased to take them at this time. Dan or Deepika or Emily, do you want to add any thoughts? I sort of tried to run through as best I could those questions that had come up, and I didn't really open it up to your comments.
I'd just jump in and say that I hope people view this as the start of a conversation, and that we're on the constant lookout for partners and people who want to reach out and support this work and help us across, I think, the activities of health promotion and social development. In particular, to reach out to us for connection to WIRA and the work of the research network that we're putting together there. So there's both the content and substance of the work that we're doing, but using this as a starting point to go forward and develop new partnerships with people who have interest in this work.
Yeah. Thanks, Dan, and thanks, Doug. If I could just add to that, yes, we are we're looking forward to more collaboration, and the rationale for starting this survey is it's a huge demand in the countries where we are working, and because our country offices, UNICEF country offices across 7 regions, they are all working on, as I mentioned, 81 country offices working on school-based, school-linked health, nutrition, and social development programs. So this is a demand that came up, and then we collaborated with Dan and Doug to and started to give a shape to this survey. But I'm sure that once now it's in the public domain, and please do share your inputs so that we can make it more concrete, and which would be a very useful tool for the country offices. We'll also look into the specific questions that you've commented on, implementation, and how do we synergize with the regional efforts. So we'll be looking into that and responding later. Thank you.
Emily, any thoughts as well as we start to close?
Thank you, Doug. I don't have anything to add. I think a lot of the questions were really geared towards the survey, and what this shows is that definitely looking into data and how to then ensure we can make good use of it and disseminate it. It's a key concern for all partners, and we will be very happy to see how we can not only contribute to the survey, but also ensure the results can be useful and disseminated. And I'd like to thank also, I saw a number of resources being discussed and shared in the notes, so we took note of those as well, so thank you for that.
Excellent, thank you. And maybe as we start to close, I again refer you to the freshpartners.org website. Go to the webinar page, and there we for the draft documents, and my email address, it was noted earlier. Please send me any comments or suggestions as we move forward. I'd like to sort of take this opportunity to not only thank Emily and Deepika and Dan, but also to do a little publicity about the remaining 5 sessions in this series. This is started as really as a conference panel presentation that we're going to do at the Comparative Education Conference that was scheduled for March in Miami. That conference has gone virtual, and our panel presentation, which is formally part of the conference, is happening tomorrow. It's on the same website, the same web link address as you used today, and we're starting 2 hours earlier at 7 a.m. Washington, D.C. time. And there will be a panel of several people who have been all leading different parts of the FRESH related work. There has been already 2 sessions, one led by Martin Henry from Education International, the Teachers Federation, and Esther Cole from the Brookings Institution on broad learning opportunities and the need for a holistic, broad set of curricula that cover a wide range of learning opportunities for young people. Dan and I did a session earlier on the work of the FRESH Working Group that has been again, there's a full hour of recordings that you'll be able to track down. And then next week we're doing a session highlighting the work that's been done, led by Save the Children, but also with a project that was funded by the Plan International UK, which is looking at low resource countries. As that's another part of the broader view we've been trying to take a look at in terms of school health and development programs, being able to understand the context and to be able to share not by region around the world but by context around the world. And so Save the Children has done a really good job of collecting knowledge over the past 3 years in a series of webinars, and there's other sources to that. And then the final session, we're going to be looking at the FRESH draft indicators on calling them cross-cutting themes, but they are addressing implementation, capacity, and systems change issues. It's a draft set of indicators that is being developed by the FRESH framework, and that's going to occur on April 29th and April 30th moving forward. So if you can put those, and those will be starting at the 9 o'clock Washington, D.C. time, at the regular time for most of these sessions. So thank you everybody for participating and being patient with the technology. I'll try to figure out why we couldn't upload our slides directly in, and I'm sorry that it prevented me from facilitating as much as I like to. So thank you again for your patience, and I look forward to working with many of you in the future. Deepika or Emily, any further comments? Dan?
Thank you, and be safe.
Yes, that's a good message to stay with. Be safe. Be distant but connected, as they say in British Columbia. I imagine it's being said a lot. Be distant but be connected. Okay, thank you everybody. If everybody could make sure I'm going to stop the recording.